The best way to understand endobiogenic medicine is to see it in practice rather than just to understand it as a theory. A 22-year-old young man came to me. He was diagnosed with diabetes, type 1 diabetes, and autoimmune thyroiditis, which started on his 14th birthday. For the last 8 years, he'd been under the management of an endocrinologist. He was on insulin, and he was receiving levothyroxine to support his thyroid. Despite this, when he came to me, he had a hemoglobin A1C of 9.1, and his Novolog dose was 30 to 40 units per day. He was not feeling well. He was feeling tired all the time. And he came to me, and he already knew about endobiogenic medicine because I treated his father for colon cancer. So he said, I want you to help me feel better and to reduce the doses of my medications. So I did an endobiogenic evaluation. I listened to him tell me about how he felt managing his diabetes. I realized that his diabetes and his thyroid disease both started on his 14th birthday. He had explained to me that his maternal uncle had lived with the family while he was dying of cancer, and this young man had become close to his uncle as a boy. His uncle had died just a few months before his birthday. So in my mind, part of the significance of this is that the intense grief that this boy felt and the feelings that he had and the intensity of his thought process overstimulated his pancreas, and that led to the development of the type 1 diabetes. Now you may ask yourself, what is the relationship between thinking and the pancreas and diabetes? Because lots of people have grief and lots of people think a lot, but they don't develop diabetes. As you know, diabetes has a genetic basis, and there are markers we can measure in the blood to look at people who are genetically predisposed to diabetes. So the first thing is that from the perspective of endobiogeny, the terrain of the patient is always based on their genetic heritage. We do not disregard the effects of the genome. What is important to understand, though, is that while each person has a specific set of genes, not all of those genes are ever expressed at one time, and they're never expressed in the same way in different phases of life. So what is important to understand about a person's terrain is not their genome or the genes that they have, but their phenome and how those genes are expressed in real time at any one point in a person's life. So because of this young man's age at 14 and where he was in puberty and the activity of estrogen, he was at a particular level of sensitivity compared to somebody else. The relationship of thinking and feeling to the pancreas is that the level of brain activity increases significantly when a person starts to think or have an intense emotional experience. If you put a person in a functional MRI scanner or in a PET scanner and you have them think about a traumatic event that happens, you can actually see an increase in the use of glucose in their brain as they start to relive traumatic memories. So we know scientifically that there's an increase in the amount of glucose that's needed to think during stressful times, be it mental, emotional, or physical. And the more a person thinks and the greater the metabolism of their brain, the more nutrients you need to nourish the brain. The rate of the absorption of nutrients from food is determined by the exocrine pancreas. So the more of a demand there is for metabolism, the greater the exocrine pancreas needs to work in order to produce more digestive enzymes. And in order to furnish the proper amount of glucose for a very intense and prolonged level of mental experience or emotional experience, in order to provide the glucose for an intense mental or emotional experience, the endocrine pancreas needs to provide increase the amount of glucagon to liberate glucose from the liver. And then insulin and glucagon need to manage the availability and distribution of glucose, including to the brain. So in this way we see how the pancreas plays a role in not in how we think or how we feel, but in allowing us to think and feel a certain way. Otherwise, if the pancreas couldn't manage the level of glucose, a person would simply faint, or they would go into a long and deep sleep. So there is an indication that this patient had a prolonged and intense mental and emotional experience which overstimulated his pancreas. So in the face of having a genetic predisposition, it gave us a clue to why he developed diabetes at that particular time of his life and not sooner and not later. The relevance of this it comes out later in the analysis, but it was important to listen to the patient and not just look at his blood sugar level and quickly decide how to treat him. On further discussion with the patient, I found that in general he tends to be a very introverted and shy person. He's very creative, but he doesn't share his creative work with anybody. He has a lot of feelings and thoughts, but he doesn't communicate them well, even within his own family. So in this way, we see that he has a strong parasympathetic nervous system. And the parasympathetic nervous system is represented by the vagus nerve, and the vagus nerve stimulates the pancreas. So now we see that there's a further level of confirmation of why his pancreas tends to be overstimulated and why he might be resistant to insulin. Because remember, when he came to me, his hemoglobin A1C was 9.2, despite being on an insulin pump and continuously receiving insulin. And he had an elevated blood sugar level. His fasting blood sugar was 210 milligrams per deciliter, which is significantly elevated. So we see that despite receiving this therapy, his body was continuously resisting it. With respect to his thyroid function, his levothyroxine had recently been increased from 175 micrograms per day to 200 micrograms per day, which is an elevated dose. Despite having an elevated dose of levothyroxine for his thyroid, his TSH was 10.1 when he came to see me. And he had normal levels of free T4 and normal levels of free T3. So this was indicating that despite the fact that he had enough of the levels of thyroid hormones in his blood, his body was not receiving the effects of those hormones. That again, there was resistance to thyroid hormones because the TSH was elevated and he felt tired all the time, in the same way that he had resistance to insulin because his blood sugar was elevated and his blood sugar was poorly controlled. I did a detailed physical examination where I evaluated signs of adrenal fatigue, such as dark circles under his eyes. I determined other signs of increased activity of the vegetative nervous system, such as cold and sweaty hands and feet, and his odoriferous or bad-smelling feet. And then I did the biology of functions, and I looked at the indexes related to the management of glucose. The insulin index was low. The insulin resistance index was elevated. The ketosis index was elevated. His thyroid, the effects of thyroid inside the cells, the thyroid index was also very low. So in this way, we had a history, a physical, and the biology of functions blood analysis, which all confirmed each other and allowed me to choose a very precise treatment for him that would best support his diabetes, his thyroid issues, and start to help him feel less introverted or shy. 3 months after starting an endobiogenic treatment, the patient came back to see me, and his hemoglobin A1C was reduced from 9.1 to 7.2, which was extraordinary. His TSH had come down from 10.1 to 3.6, despite the fact that we had reduced his levothyroxine from 200 back down to 175. So in other words, we reduced the dose of his thyroid medication and improved the sensitivity of the thyroid hormones at the cellular level by using an extract of kelp as a tincture. His fasting blood sugar level completely normalized from the low 200s to 88 milligrams per deciliter, which is in the normal range. The patient also reported feeling better, and he had reduced dark circles under his eyes, and he was able to sleep better at night. So we see that in just a short period of time, by doing an endobiogenic analysis, we were able to preserve and respect the need for him to receive exogenous hormone treatment, but we supported his body and the terrain in order to allow the body to be less resistant to those treatments and to support the general functioning of his body. A 42-year-old woman from Ecuador came to my office for treatment of high blood pressure for hypertension. She had seen the best cardiologists in town. She'd seen the best integrative medicine cardiologists in town. And no one was able to help her treat her hypertension. Everybody kept trying to use antihypertensive medication, and she kept tachyphylaxing, so her dose of the antihypertensives kept going up. And the other approach that everyone kept using was to lower the activity of her alpha sympathetic nervous system, because they figured that she had a lot of stress, so they kept giving her magnesium and valerian and chamomile and other types of relaxing agents, but none of it affected her blood pressure. She came to me for an endobiogenic analysis. I took a detailed history, and I determined that she had grown up in a privileged household in Ecuador, and she always had servants and maids to help her and help her mother. When she married and moved to the United States, she married someone who was not from Ecuador, and when she moved here, she had no maids, she had no servants, and she was not mentally prepared to manage the household because she was trained to be a teacher. And so the shock of those domestic requirements had actually initiated her high blood pressure. So there is definitely an emotional and a physiologic component with the alpha sympathetic nervous system at play, but there seemed to be more at hand. It turned out that she was a very athletic woman. She loved to play soccer, and she had a lean athletic build. So this gave me a clue that she had a certain level of functioning of her androgens that might be playing a role in her high blood pressure. I did a careful physical examination, and then I looked at the biology of functions. And what I found is that she had elevated androgens, and based on my assessment, I determined that her androgens were expressing themselves inside of the artery at the level of the tunica media, where there are a thin band of muscles. So in other words, what was happening is that it was not that the arteries were too constricted from alpha sympathetic stimulation, it was that the size of the artery had been reduced because the muscular layer was overgrowing and narrowing the total size of the artery. Now, of course, she had hypertension, and she was ready on a combination antihypertensive. I left her on her original dose of medication, but I started to treat her using the types of products that we would normally treat men with an enlarged prostate with. So we started to reduce the effects of androgens on her body, reduce the adrenal overreaction to stress, and over the next 4 years, we were able to reduce her blood pressure medication by 60% and keep her at a normal stable blood sugar, at a normal stable blood pressure throughout the year. In addition to that, she also had some issues related to her immune system. She would get cold sores frequently, and she would get sick when her children were sick. And by treating the adrenal gland as part of the issue of her hypertension, it naturally improved her immune system without having to add additional treatments to support her immune system. In this case, the endobiogenic analysis provided a deeper level of insight into some of the more subtle reasons why a person might have hypertension. By supporting not only the regulation of androgens and the growth of the medial layer of the artery, but by supporting the adrenal gland and regulating the response to stress at a deeper and more fundamental level rather than symptomatically trying to make her more relaxed, not only did I improve her hypertension, but it also improved her immune system. She used to frequently have cold sores, and those resolved on their own. So this brings up a good point about how efficient the endobiogenic treatments are. Rather than simply treating each symptom with a different remedy, when we see how many different symptoms come from a common set of hormonal imbalances, we can treat the root cause and many symptoms will improve or completely resolve. In this way, patients can be on the least amount of treatments, we can lower their cost, and the patient is happier and you get better results. Oftentimes in my endobiogenic practice, parents bring their children to me because they're not growing well, they have failure to thrive. And from the endobiogenic perspective, there's many different levels at which failure to thrive can be occurring. As most of you know, most cases of failure to thrive are simply diagnosed as idiopathic because we can't find any hormonal problem just by measuring growth hormone levels or IGF levels in the blood. So most of these children don't qualify to receive recombinant growth hormone, and they're simply left for the tincture of time to try to treat their failure to grow. From the endobiogenic perspective, there's many different ways in which we can understand why a person's not growing. It could be related to the pancreas and the ability to break down foods for them to be absorbed. It could be related to small intestinal inflammation and leaky gut and the inability to absorb the nutrients. It could be related to hepatic dysfunction and an inability to sufficiently metabolize and distribute the nutrients. But in addition to these important emunctory functions, all nutrients in the body are only incorporated to the degree to which various aspects of the endocrine system stimulate the cells to need those nutrients. In other words, just feeding somebody is not an assurance that they will digest the food, absorb the food, distribute the food, and incorporate it into their cells. It is the endocrine system, once again, which manages and determines the need for those nutrients, the amount of those nutrients, and the rate in which those nutrients are absorbed, and which parts of the body will absorb those nutrients. A 4-year-old girl, she was twin B of a IVF pregnancy, presented with failure to thrive. Her twin had no problems growing, but she did. When I listened to the history and I did a detailed physical examination and then the biology of functions, I was able to determine that the level of imbalance was 3. Her pancreas was not functioning well to break down the food. Her liver was not functioning well to distribute the nutrients. And her adrenal activity was imbalanced in such a way that it was permanently blocking anabolism from occurring. So even though her parents were feeding her, the signal to the body was to remain in a permanent catabolic state and not incorporate new nutrients into the body, but to simply recycle what nutrients were already being circulated from the activity of cortisol. In this way, I was able to develop a very precise treatment using a single tincture containing 4 different plants. I supported her pancreas with digestive enzymes, and I offered her some trace mineral or oligoelement support to stimulate the incorporation of nutrients within the cell and to improve oxidative metabolism. Over a 6-month period of time, the patient experienced the most rapid rate of growth, vertical growth, as well as weight gain that she had ever experienced in her life. And again, because of the efficiency of the endobiogenic treatment, she had a history of recurrent urinary tract infections. Every 2 to 4 weeks, she would get a urinary tract infection despite being on prophylactic antibiotics. When she came to see me, her urologist had stopped her prophylactic antibiotics, and despite stopping them with the endobiogenic treatment, she went almost 4 months before having another urinary tract infection rather than 2 to 4 weeks.